Welcome to Your Health. It's September and the kids are all back in school now. And this is really a very stressful time, not just for the kids, but for the entire family. So joining me today is Karen Kowalczyk, who is a nurse practitioner at Elmhurst Clinic right here on Lake Street at 303 West Lake Street. So welcome, Karen.
Thank you, Lucille. It's nice to be here today.
Oh, I got a lot of questions for you because, you know, this, as I said, is really a very stressful time, not only for the kids, but for the whole family. Mom and dad are back to the work routine, kids are back to the school routine, we're back to the sports routine. You know, you had this summer off with vacations and fun and relaxing, back to the routine. So once we get through the Labor Day weekend, that freedom is over. So what kind of tips can you give us to get the family started with the kids in school? And you know, they have to be on the bus by 7:30 in the morning, and you know.
They do. It's a very hectic time of year. Very important, I think, is to schedule and plan, because the better you can schedule, the more you can plan, the easier your morning is going to be to get those kids up, to get them fed, and to get them going.
Well, before we feed them and we get them going and everything, you're a nurse practitioner.
Yes.
Let's tell our audience what a nurse practitioner is, what you can do, and why should they come see a nurse practitioner if they can't get in to see the doctor?
Well, a nurse practitioner is an advanced practice nurse. What that means is that we are nurses that have advanced training, usually at a higher educational level, whether it be a master's degree or now even a doctorate degree. What we are trained to do is to assess, diagnose, and treat common and chronic illnesses such as asthma, such as diabetes, such as hypertension, but colds and flus and ear infections, sports injuries, things like that. But what makes nurse practitioners different than doctors is that we do a lot of focus on prevention, wellness, and education. So if you came to visit me today with an illness or even just for a physical exam, you would go home with a lot of information of what could possibly be your illness or your problem, but a lot of tips on how you can, in general, be a healthier person.
That's what you're going to fill us in on today.
Yes.
How we can get these kids back to school and get them back healthy and back into a healthy, good routine.
Yes.
I know we were talking before the show about routine. Yes. Routine is very important. Organization and planning out your day before the day actually comes is important. So kind of give us a little bit of insight to what you think about that, like laying out the clothes and packing a breakfast.
It is, you know, I was never a morning person, so this was very important for me when my kids were younger going to school. But it sets up a schedule for the day. You have your child in a routine. They know what to expect. There's no surprises. And if the surprise occurs, it's much easier to manage. Lay your children's clothes out the night before. If your child wears a uniform, make sure it's all ready. Get their underwear, their socks, and their shoes ready. If your child does not have a uniform, let them help pick out the clothes for the day so that there's no struggle in the morning. Have the lunches packed the night before, so as the kids are hustling and bustling around in the morning, you get everything packed up, here you go.
Including the backpacks. I mean, they should have everything in that backpack, not their lunch, because that usually has to be in a refrigerator, but breakfast. The bus leaves at 7:35 and the kid doesn't crawl out of bed until 7:15. How do we get that child to get a decent breakfast?
Well, there's, you know, a lot of different things that we can do. The focus that you want to encourage your children is to eat some type of breakfast. Your children have been on a fast possibly since dinner last night. Maybe they've had a little snack before bed. So they've gone anywhere from 8 to 12 hours without any fuel for their body. So they need something that is going to get their body up and moving so that they are ready to learn. Something like a piece of whole wheat toast with some peanut butter and sliced banana. That's a really easy breakfast that is easy to make and the kids can take it on and go.
They can walk out the door with that in their hand because their backpack's on their back with everything in it.
Exactly. There's lots of recipes out there for healthy morning muffins or morning breakfast bars that you can make on the weekend. You take and you cut them up and you put them in little Ziploc baggies and put them in the fridge or the freezer. Put them in the refrigerator the night before to defrost if they're frozen. Boom, you hand it to the child, they're out the door with a good healthy breakfast and they'll be ready to learn.
And actually, they're very tasty because I eat breakfast bars frequently because I'm always in a hurry and I'm not a big breakfast person, but they're really tasty.
They are delicious, often with oatmeal, with dried fruits, nuts. They have a lot of flavor to them.
A little chocolate in it, it makes it
Hey,
a little.
a couple little chocolate chips make everything better.
Make it a little bit better. And explain why adequate sleep is so important. I know, and that's very difficult because the kids come home from school, they try to get down and do their homework, maybe grab a snack. But then with the sports, sometimes they're not even getting home from whatever their sports activity is until 8:30, sometimes closer to 9 o'clock.
Yes.
So how do you set up a good sleep schedule and why?
Setting up a good sleep schedule is really, really important because when we sleep, that's our body's time to heal. It's our body's time to rejuvenate itself physically and mentally. Kids who go without enough sleep are often irritable. They're not easy. They can lack concentration. It's harder for them to learn. These are all problems that we're just not going to see that they're yawning. This is going to go on and on. So by setting a good sleep routine and a sleep schedule that you keep throughout the week, not just during the school days, is going to help your child succeed.
So you establish a bedtime and you keep that.
You keep the bedtime. You let them know if your child, let's say, your child needs 9 to 12 hours of sleep a night. Teenagers fall right back into this category because they're going through all of this physical and mental growth as well. So we're going to include the kids all the way from preschool through high school that they need a lot of sleep. Set a bedtime schedule. This is the time that you're going to go to bed. A half an hour before having the kids ideally be into the bed is start giving them, hey, half an hour until bedtime. Have them turn off all of their electronics, brush their teeth, wash their face, do whatever they need to do prior to going to bed. Dim the lights. At this point, we want to be turning off all of those electronics.
See, and that's something else too. Like the TV, a lot of people fall asleep with the TV on, and kids today with the cell phones and iPhones and everything, they're on. You hear the texts coming through, you hear the TV on, but you were telling me earlier that it's not just what you're hearing.
No, it's not, because you hear the TV, and some people like just having that noise in the background, which is fine. But when we're sitting and looking at our tablets, when we're watching the TV, when we're looking at our cell phones, there's a blue light that emits from these electronic devices that tells our brain it's daytime. So our brain is not shutting off to go to sleep. So if you find that your child is one of those types that likes having a little bit of noise to go to sleep, turn on the fan. There are little sound machines that they sell that are pretty inexpensive that will have white noise. They will have the sound of thunderstorms. They will have the sound of the ocean.
Which is relaxing.
It's very relaxing. They also have now music that they're coming out that has actually been the different tones, and a lot of them have the sounds of the ocean and maybe like little seagulls that actually help us sleep better.
What about if they like a particular singer or music? But it's not always restful music.
Yeah, you have to be really careful because, when you have high intensity music that has a harsh beat, it's going to stimulate the brain. What we want to do that half an hour to an hour before bedtime is start to shut the brain off, start to slow it down. And this is why it's so very important to turn off the TV, not watching movies, that have a lot of action to them, not listening to music that are high intensity, starting to slow the brain down and getting it ready for sleep.
It's the white light too that kind of wakes you up, that little white light that you keep spotting with television, because especially with the commercials, they come on with bright light, and the iPhones, you get a message in the middle of the night.
You hear it.
Well, you see it. You see it too.
Yeah.
Let's get back to nutrition. We talked about breakfast and carbs and protein and I know it's important, but give us some ideas. Give our audience some ideas what they can do to pack a decent lunch.
Well, it's very important. You as parents are your providers for the children. So you are the ones that are going to set the guidelines for how your children are going to eat. If you have a house that is filled with good quality nutritious foods and you serve those to your children, they are going to know nothing different except to eat healthy. If you have a house that has a lot of junk food, a lot of snack foods, a lot of simple carbohydrates with no nutritional value, the kids are going to get used to eating that, are going to become more resistant to eating the healthy foods. But a good nutritious lunch is something that has a complex carbohydrate, such as a whole wheat bread or whole wheat crackers. It has protein, such as turkey, peanut butter, cheese sticks, and then fruits or vegetables. Kids like things that are interesting. A sandwich is fine, but you can make it certainly a whole lot more interesting by providing little baby carrots on the side, maybe with a little light ranch dip, or, fruit cut up into little pieces or little squares, or little pieces of cheese. Kids like things that they can pick up with their fingers.
Finger food. It's quick, it's easy. They don't always eat it at lunchtime. I see sometimes kids picking on the carrots walking to class.
Right.
But it's really cost effective to buy healthy.
It is, because it can be very, snacks can be relatively inexpensive, but the problem is they don't, like I said before, they don't have a lot of nutritional value. So by not buying the snacks, not buying the sodas and the fruit juices, will give you money to buy more of the foods that are going to raise healthy children, that are going to improve their minds, that are going to put the child at a better place to learn mentally and physically.
And it's just as easy to put a bowl of fruit out as it is to put a bag of chips out.
Oh, completely. And I've done it for my family many times, because let's face it, we all like chips, It's easy to grab a handful, but guess what? It's just as easy to grab a handful of grapes.
Exactly, and put it on the table.
Right. The thing is, when you buy the fruit, take and cut it up, wash it, put it in a bowl, have it easily accessible. That's what makes your children more apt to eat it.
That's key. Make it easy.
Yes.
It takes a few minutes.
Yes.
It takes a few minutes, but your kids are important.
Right. And you can involve the children in this. When you're grocery shopping and, the kids are around, come on over here. Let's wash these grapes. You take the grapes off the stems and put them in the bowl here, or put them in the container. Or if there's something that, is soft enough, give them a butter knife to help them cut up. Involving your children in food preparation is going to make them interested in what they're eating. And the more that you involve them, the more they're going to be eager to eat these foods, because they played a part in it.
And they also have conversations with you.
Yes.
Which is really nice to kind of sometimes find out what kids are thinking and who they talk with, and it's a conversation. It's something.
Any opportunity to talk to your kids is a great opportunity.
And it's time for they talk because they have nothing else to do, and I'm helping you. This is terrible. However,
and then all of a sudden they're going to start getting
Yes.
used to it, and they're going to enjoy it.
And I think we enjoy it just as much as parents. Now, we talked about the lunches and the backpacks, getting them ready, but these backpacks are getting heavier and heavier, and it's sometimes I feel it's not healthy. It physically affects these kids.
It is, because when they're carrying a bunch of books, especially these high school kids, if they're still carrying these big textbooks, they may be holding 15, 20 pounds on their back.
They're heavy.
Yes. So the key is for all children, from your little ones all the way to your high schoolers, is get a lightweight backpack. Get one that has big, thick shoulder straps that have padding, and encourage your kids to use both straps. Real easy, and we're all known for this, especially us ladies with our purses, is just throwing it on one shoulder. Well, that causes a lot of muscular strain, a lot of physical strain on the shoulders and the back. So we want the kids to put both arms through the straps. Put the heavier books closest to the child's back and the lighter objects in the front, because that will help distribute the weight a little bit easier. If you can find the backpacks that are like the rolling backpacks that kind of look like the suitcases,
but kids
that you
don't
go,
always like them.
They do. Those are the healthiest version, but they're coming out with some pretty cute patterns. So I think it might be a little bit.
Make some of the changes, because if it's cute, they might use it, and if one uses it, then a couple might use it, and it grows on them. Also, a padded backpack, because sometimes those books are. They're right up against their back.
Yes. So some of them have a padding against that back. So in combination with the padded straps and that padding, it makes it more comfortable for your child.
Now, there's something else that concerns me, is returning back to school sometimes is a time of great anxiety for kids. It's stressful for the kids. It's also stressful for the parents.
Yes.
And how do we both deal with it? Because I know a lot of kids just don't like school, and they create their own anxiety, but sometimes there's just anxiety.
There's lots of components to this, and this is why it's so very important as parents to be prepared, to be organized, to do a lot of these prep things, such as making the lunches the night before, having breakfast ready, having these bedtime schedules available, because there's a lot that goes into a child's mental health. Adequate sleep, adequate nutrition is very, very important. But it's very important, like we were talking before, talking with our children, is gauge how they're responding to school. Do they like their teacher? Do they like the classmates? Are they having trouble in a certain subject? Are they having trouble with friends? Can they see? Can they hear? These are all very important components to keeping a child's anxiety at bay.
Yeah, because sometimes they're afraid to go back. This is a new classroom, it's a new teacher. Maybe they've been bullied and you don't really know they've been bullied. These things happen, but if they're having issues, sometimes if you talk to the teacher that has them for the bigger portion of the day, I don't like to say that, but sometimes there's disabilities that we don't know as parents, and they're simple fixed disabilities.
They are. Some of them are as simple as your child can't see the board. They're sitting in the back of the classroom and they can't see the board. They're not going to know to tell you, I can't read the writing on the wall. They don't know that that may not be normal. You may talk to the teacher about moving their seat up. The other thing is when was the last time your child had their eyes examined? Because realistically, we only require, or the schools only require, an eye exam going into kindergarten. Well, that's a long time from your child being
change.
5 or 6, definitely, to being in high school. Our eyes change. The more that we read, the more that we use these electronics, these are going to cause changes to our eyes. So get your child in every year to have their eyes examined. There's lots of different places around that have back to school specials, but it's really, really important. They say your eyes are great. Wonderful, but it might be something as easy as your child has a problem seeing close or has a problem seeing far. A pair of glasses can make that disability go away.
And there's 2 other things that people don't think about. Sometimes dyslexia is not noticed because they were born with it.
Right.
They live with it, but now they're in school and you don't realize they're dyslexic, so they just need to be taught in a different way.
Right, and this is where it comes in that it's so very important to have good communication with the teacher. Pay attention to your child. Sit and read with your child. I believe that it is important to start reading to your child as babies. Get them used to looking at books, that there are words. And that for the little ones, that there are pictures associated, but you are going to be the first one to pick up, why are they keep messing up these words?
Exactly.
So you have to be in tune, but also talk to your teacher. You know, the conferences come up periodically, but keep close contact with the teacher. Is my child struggling somewhere? Do you notice that they are not keeping up with their peers, that they may be having problems in math, problems with reading? Communication with the teacher is key.
And sometimes it's a hearing issue, and there is no need for a hearing test when kids enter school.
Right, we don't do
But the teacher would catch that,
The
possibly.
teacher may or may
you-
not, you know, but it's certainly something. When you talk to your child, do they acknowledge you? When you're across the room and you are talking to them, do they hear you? Do they answer you appropriately? There's a bunch of different things that can be the easiest fixes. Your child may have wax in their ear. Wax can build up in their ear. It blocks the sound from going into the ear canal. Your child can't hear.
And it might be seasonal because of allergies. I mean, so if a child is fine in the winter, but spring and fall, they have allergy issues which help develop the wax.
It can help develop the wax. It also can have a little bit of fluid behind the eardrum, which, you know, helps a child
fix.
create. Yep. You know, they can certainly come in, we can assess them, see exactly what's going on. You know, there's always the possibility of sending a child for a hearing test if we find that there's no easily identifiable cause. You know, so we've got those resources available at our fingertips that are going to help your child learn even better.
Simple fixes.
Sometimes they
Simple
are.
fixes. And then there's so many things I would love to talk to you about, but we don't have a lot of time. Concussions, sports. I mean, they're in sports all summer long for the most part, but in the course of the school year, they're in gym classes, plus they're in sports, and we forget about concussions that aren't really hitting your head. They're just jostling your head, which rattles the brain inside of its skull.
It does, and essentially what is a concussion is when your brain is shaken up within the skull. It's almost like taking your brain and shaking it like you would a snow globe and seeing all the little snowflakes. Well, those are all the neurotransmitters in your brain that are disrupted due to this force of the brain moving within the skull.
It doesn't have to be a hit in the head or a bump, or you don't have to fall and hit your
It can
head.
just be a quick jerk action. And we do see it a lot as the summer sports are a little less intense. We do a lot of swimming, playing on the playground, but that does not make a child immune from a concussion. But as we enter the fall, it's football season.
Oh, I know.
And a lot has been done lately, you know, with the movie coming out with Will Smith that focuses on concussions within professional athletes. But now we're starting to do a lot of research that is identifying the problems with concussions in kids as young as being high school and college athletes. Concussions are most dangerous in small children because their brains are still growing, they're still developing. And repeat brain injuries or concussions are even more detrimental. So what can you do to keep your child safe? There's a lot of different things. The football practices are now.
Yeah, but what about soccer? Nobody wears any helmets
Well,
or
this
anything
is-
in soccer. There's a lot of things that
This is a lot because football, they're kind of keeping an eye on. But soccer, the kids don't wear helmets. Ice hockey, the kids do, but not in figure skating.
Right.
So you have to teach your child. If you notice that, you know, your child has fallen and hit their head, if all of a sudden something happened and they develop a headache, if something just doesn't seem right, you have to go back and look at what happened during that practice.
and it just go see the doctor.
Go see the doctor.
Go see the nurse practitioner.
Yes.
Go with your gut. People don't realize when you're a parent, and I said this to my kids when they were having their children, I can't tell you how to notice that something is not right with your children. You'll feel it. You'll just know. A parent just knows.
It's that gut parental instinct.
Go with the gut.
Yes, and if there's ever a question, come and see us. There's a lot that we can do to evaluate your children, and there's a lot of things that we can do to guide you along the concussion healing process if a concussion does occur.
So give us a phone number. We know that you are at 303 West Lake Street, the Edward Elmhurst Health Center.
Yes.
Is there a phone number that they can contact you, or a website that they can contact you to set something up?
Definitely. The phone number for the Family Practice Group, and we've got locations at the Addison office in Lombard and at the Schiller office in Elmhurst, is the phone number is 331-221-0001. You can also go to the website for Edwards Elmhurst Health and sign up for My Chart, which is a communication system through the computer that you can request appointments, you can schedule different examinations, and it's also great for communicating with your healthcare providers. If you have a question, if you have testing done, this is all done through the computer. And let's face it, many of our young parents are very technologically savvy.
A lot more than I am. Well, Karen Kowalczyk, thank you so much for being here today. I think we have to have you back and talk about concussions all by themselves at one point.
That would be an important topic.
So thank you all for joining us. I'm Lucille Zucchero and Karen Kowalczyk, and here's to your health.